Hello, I'd like to try to compact 15 minutes worth of conversation that needs to cover an entire 7 years of field research. So we're going to be brief, and I want to emphasize that we're going to look at fertility control as a means of mitigating deer impacts in primarily local communities, and that we're using a surgical method as a surrogate, in other words, for what may happen in the future using injectable type fertility control agents. So don't look at this strictly as a one-dimensional assessment, but more of a means of understanding how demographics of a population can be impacted by fertility control treatments. The other point I want to make is we did manage to get through 7 years of research on fertility control. And so far, the world has not come to an end as much as it has otherwise in 2020. But the fears around fertility control are really unfounded. And this is really a basic understanding of what happens when these methods are used to manage local deer populations. I've got a QR code up on the screen. There's going to be a lot of data around each research site, and I want to allow you to go back to those data in a manuscript that we've submitted to the Wildlife Society Bulletin, and all those specific bits of information will be located in that manuscript, so I can avoid getting into the weeds and focus on some of the bigger picture issues. And of those, it's really what are the elements of this research that reflect on how it would apply to management. What types of study sites or management areas would be applicable? What are some of the thoughts and concerns? And then get into some of our findings here at the closing. So why would we even use fertility control? It's often, for the leverage portion of using it, it's dense neighborhoods. All right, it's very difficult to use other methods. The public is often averse to lethal methods and focused on non-lethal solutions. There's always a perception that hunting isn't safe, or even professional culling. And then there might be legal restrictions on discharge of lethal implements in this context. So it does align as you increase the density of the development. It aligns better with the feasibility and appropriateness, if you want to call it that, of using fertility control. So, as I mentioned, using fertility control as a surrogate, it has similar behavioral outcomes to either types of vaccines that are presently being evaluated. So GnRH has really been evaluated for maybe 10 or 15 years. And I think the issue with that vaccine is it shuts down any reproductive behavior. So it is more like the ovariectomy treatment that we've administered during this research. Whereas a PZP type vaccine is more like a tubal ligation procedure or a vasectomy, where the females continue to come in estrus if they don't become pregnant during that breeding period. So whether you use surgical method, what type of surgical method, what type of vaccine, it really comes down to, again, the legal aspects, whether it's even legal to use an injectable vaccine in that particular state. Are the deer really difficult to access or behaviorally not super tolerant of people, where you don't want to have to handle those animals more than once and or treat them? So a surgical approach may be more beneficial long term, and or the effectiveness, right? So surgical sterilization, if done properly, is 100% effective, whereas these vaccines may only be 85 to 90, in the best case, 95% effective. So we really need to think about what those criteria are and your objectives are, and what method you're going to or tool you're going to choose. So our goal here was to really look at what happens if you treat a very high percentage of a population. And how do the demographics change, and how do the immigration factors relative to neutralizing your effects, so to speak, of your treatment? Do we have these animals move into that area and negate any gains you're making through, we'll call it, natural attrition? And then understanding what the costs are associated with these programs. So our study sites were really anywhere from 1 to 6 square miles. So the 6 square mile area is pretty appreciable in size, trying to capture every female in that type of challenging environment. And in those areas, they were very similar in that, they're very dense housing with some mixed open spaces and very high deer densities, except for our one site in Fairfax City. The deer abundance was quite substantial. This is a typical layout. This is Fairfax City, Virginia, and you can see very dense neighborhoods, commercial, couple parks, golf course, intermixed, but very tough areas to implement lethal programs effectively across a community, whereas we can capture, as we have, virtually every animal in this 6 square mile area. But this is a very, what I would consider, compatible landscape for fertility control, but very challenging when you're trying to use a lethal method such as hunting or culling. So we'll do a quick rundown. As with most professional or selective management techniques, non-traditional, you're going to use bait to bring animals to select locations. Whole kernel corn is always a favorite. In our project sites, nearly all the deer were captured with darting equipment, remote mobilization equipment, some drop netting, but almost exclusively using darting technology. After the animals were recovered, located in a field using telemetry darts, they were manually transported to a vehicle and then to a focal point of surgery. Might have been a garage, a maintenance facility, some place that we can clean, create a controlled environment, noise-free, and easy to access from throughout your research area, so your travel times were minimized. All the animals, just like an animal going to a veterinary clinic, they're having areas shaved, scrubbed, prepped for surgery for a sterile environment. So no different than what you would do in a clinic or an animal in a farm setting. We extracted the ovaries versus doing tubal ligations, so we would not have that repeated estrus behavior, and we have no breeding behavior. And the midline incision was the optimal approach after various assessments of other surgical techniques. Animals are closed. They're then given reversal agents back in the field, and we try to find a nice quiet area where they're not going to get into trouble with water or vehicle issues on near roadsides, and they're left to recover and monitored from a distance, so the stress during that transition is minimized. We did population estimates in all 6 study areas, primarily with trail camera surveys, but then we also did helicopter snow counts to complement. And as you can imagine, if you have nearly 100% of your females captured, you end up with a mechanism to get very accurate field observations. You see every animal repeatedly. You can identify individual bucks in the landscape and figure out which females have fawns and so forth. So all those methods, when combined, provide a very accurate population assessment. As I mentioned, with the QR code, you can go back to these data and look more closely at them. But ultimately, we're seeing very substantial population declines. Most notably, the first year, we see the biggest decline, and that's really because the male fawns that obviously aren't treated, they disperse that year. A vast majority of those are dispersed, and they're not replaced by fawns because those females have been treated. So we see a very precipitous decline that first year, and then afterwards it's just natural attrition through mortality. But you can see, upwards of 70% and greater with 5 to 6 years of treatment activity. So you can significantly decrease a local population just using fertility control. And remember, these areas are open. They're not fenced. They're not islands. Deer can come and go. There's deer populations around the entire perimeter of these properties. So do keep that in mind. So after after the second year, on average, a 25% population decline. I would call that quite substantial. And again, that's because of that fawn dispersal and a very rapid response in near term But even after 4 years, we're averaging 45% population decline. And as you would suspect, if you were to work in conjunction with other methods, whether that's hunting or some professional culling, you can even accelerate these population reductions even faster. We really saw minimal immigration, almost negligible. There was only one site, the village of Cayuga Heights in upstate New York. And in that particular location, we had the severe winter weather appeared to incur more immigration than we saw at other locations. But even there, after 2 years, we had a very substantial, I think, a 37% reduction in that local population. So as a whole, the field methods and the social compatibility, we'll call it, is very compatible with suburbia. And our mortality rates were quite low, 2.6%, realizing that's fairly average for just capturing, never mind having a surgical procedure integrated into the handling. So what have we really been able to glean from 6 years of field effort across 6 study sites? We can demonstrate very substantial population declines. Immigration is very minimal. Mortality associated with handling is small. Your cost is a factor. You're looking at little over $1,000 to $1,500 per deer, but we were able to substantially reduce those costs per deer when we were able to, in a more organized and efficient manner, integrate volunteers into our field team. Really substantially reduced our professional time and associated costs. And we'll get into a little bit on what these site factors, we'll call it, and criteria that help us define the best places to use fertility control as a deer management tool. Is the local population and state agencies, right? Is there enough acceptance of the method to allow it to be permitted and then funded locally? How quickly do you want your population to decline, right? We're still seeing what I would consider pretty rapid declines, but somebody may want to see their goals met in a year or two. That may not be realistic. Can they afford a program like this? Many of the deer that do die in these environments are killed by deer vehicles during deer vehicle collisions. So that is a concern. But I look at it as if you don't do anything, you're going to continue to have high levels of deer vehicle collisions, but we were able to reduce those, coinciding with those reductions in densities. And finally, how does that site lay out? Are there enough roads for access and coordinating logistics, that facilitates and makes these programs really feasible to implement? So we do want, smaller areas, as we say. Obviously your cost increases as your size increases. A strong road network for getting around and capturing animals. Are the deer approachable, particularly along the roadsides? And making sure in those states there's enough flexibility within the laws that you can implement these programs. So what I wanted to save the last portion of this talk is how do we get to the next step? How do we keep costs down? How do we transition these programs into a sustainable long-term tool? And that involves volunteers. As you can see, we added a study site we didn't include for the population estimate or for the population assessment down in Maryland. But of our 7 main study sites, we were able to document and integrate volunteers that appreciably decreased cost of these programs. And we now have 2 programs that are able to run in a self-sufficient manner. The local staff can not only prep, they can capture animals, transport them, have the veterinary support in order to have a complete package. And we're basically advisors, remote advisors for questions and strategies and so forth for coordination. So it really is at the next level where we can use volunteers to carry on these programs and minimize those long-term costs. Anyway, thank you for your time. And we look forward to continuing these research programs to better understand how these programs will come to fruition in the future.